This podcast is brought to you by NHS Citizen. NHS Citizen is an NHS England initiative to give the public a voice on healthcare matters and influence NHS decision-making.
Since April 2013, NHS England has learned of widespread problems concerning the treatment of transgender and non-binary people across the health and care sector, including reports of unaddressed health inequalities, discrimination and reduced access to health services. NHS England's board made a public commitment at the NHS Citizen Assembly in 2014 to address problems experienced by the trans and non-binary communities and has started to make progress in a number of areas. The development of the Transgender and non-binary network has been a key marker of this progress.
Hi everyone and welcome to this podcast. I'm Nia Bennett. Today we have a really interesting person in the NHS England office, and I say interesting because of the spectacular work he does.
William Cox is a non-profit leader, consultant and life coach specialising in gender identity, helping to support individuals discover their own identity. William worked for 25 years as a business executive in property management and retail. After a successful career, he became interested in gender identity. He is a regular contributor to BBC Television's Victoria Derbyshire show and is an advisor to BBC and ITV reporters. William runs a trans support group called Generate and delivers trans awareness training. He has recently been involved with the Sun newspaper, speaking to top executives, helping them find ways of positively and sensitively reporting trans issues within the media.
So Will, it's really nice to meet you. Would you like to tell our listeners a little bit about yourself?
Hi Nia, thanks. My name's William Cox. I live in York with my partner and 3 kids and 2 big dogs. I do quite a bit of voluntary work and run a support group in York called Generate.
That's brilliant. So can you tell us a little bit about how did you first get involved in the NHS England's work?
Yeah, I think the first thing I did was when I was invited to join a trans men's focus group to sort of give some feedback with that, and also representing a charity that I volunteered for at the time. I came to join NHS England on the Transgender and non-binary symposium.
That's brilliant. So how did you come about becoming a patient and public voice partner? Is that something you knew about, or did someone kind of invite you into that process?
To be honest, I knew nothing about it at the time, and I was invited to come and join the focus group, like I said, for trans men, because they were looking for people who had experience in that field and wanted views on what needed improving in the healthcare system.
And would you be happy to walk us through the work of NHS England's trans and non-binary network?
Yeah, it's about sort of getting input from the sort of more seldom heard groups, I think, really, and finding out where the gaps are in healthcare so we can improve services. So, for example, with the symposium, that was really good because we got together with a lot of senior board members from the NHS, trust members, clinicians, and also the charities came together as well to sort of discuss treatment and support of trans people.
So could you tell us a little bit about the highlights of being involved in the trans and the non-binary network and the impact of this work?
Yeah, I think the highlights for me is, getting to speak to senior people within the NHS and seeing that they actually genuinely really care and want to make a difference. I think that was really important to see that because you kind of wonder where, how interested people are, and in reality, it turns out that they are very interested and they really do want to make a difference. So being able to interact with people at that level and get everyone together has been really powerful.
So what sort of senior people have you come across? Is it clinicians? Is it senior board members?
Yeah, absolutely. Yeah, clinicians, senior board members. We bring the charities together, and individuals as well, because, they really do want to hear from individuals that are experiencing difficulties, and also the positives, of course, what's going well.
So basically, the Trans Network gives you that opportunity to network with influencers in the healthcare and kind of give your opinion and your views.
Yeah, and to feel that, it's really valued as well, because I think that's important, which means then we can sort of take it back to our own groups and networks to share what's actually going on and how these improvements will make a difference.
So can you tell us if you've undertaken any of the NHS England training and development for PPV partners?
Yes, sort of working at different levels, it sort of became quite apparent that I could use a bit of help and training in being able to become more effective as a volunteer. So I've done a couple of courses, actually, the facilitation and engagement in the health and social care environment, which was really good. I think that was my favourite. And understanding the health and social care environment, which was completed, I think, just the end of this year. More recently, I've joined the peer mentor program, so I've just been doing some training with that so I can help other volunteers get involved and move things forward.
How do you think the training, because you mentioned a few training programs, so how do you think those trainings have actually influenced you and helped you in making an impact in the network?
I think they've actually been really important because it gives you the confidence, so you know sort of how to engage better to make more effective changes. Because I think some of the work that I've been involved with is quite emotive, and previously, before we sort of received training and before others maybe received training, it was quite easy for sessions to get carried away, and we'd sort of end up talking about things rather than how we're going to move things forward. So, yeah, it helps focus people's thoughts and helps us move things forward, really, so we, in a more constructive way.
That sounds really interesting too, because there's a sense of giving back.
Absolutely, and this is quite new actually, so it's only something I've just started. So I've just received the training, which was really good fun, and now we'll sort of be interacting with new people coming in and showing them the ropes, sort of how to engage more effectively and make the most out of the opportunities.
In terms of health, can you tell us a little bit about some of the challenges that you've experienced or you've seen some people close to you within the trans and the non-binary community in accessing health in England?
Yeah, I think, again, when I first started in this work, there were many challenges. And credit to the NHS, they did put their hands up and say, yes, we need help with this because there's a lot of stuff that needs changing. So access to GPs, there's still ongoing issues, but there are improvements with trans people going to their GP, asking for referrals, and the GPs not knowing what to do, for example. There's also sort of been a feeling, really, of not being listened to, and I think the waiting lists have been so long for trans people that people have got really despondent. There's been big problems with mental health because of this. You feel you've not got any help or support. So I think sort of mental health, accessing gender services have been really one of the biggest sort of problems.
And from your experience then, have you seen any change in the delivery of services since you've been involved as a PPV partner in NHS England's work?
Yeah, I think one of the key things is just as simple as communication. Previously, if you sort of joined a waiting list, for example, to attend a gender clinic, you could be waiting up to sort of 3 years, possibly even a little bit longer when it was at its worst. And that kind of left a really big sort of gap between sort of receiving any support whatsoever. And the communication has really increased people are getting letters, just a simple letter to let them know sort of whereabouts they are. And also there's like a pre-appointment now. So you will get a phone call from the clinic, fairly early on, within sort of the first sort of 3 months, even a couple of weeks of joining the list, to find out where you are, take a few details. And these kind of things really make a difference, just having that contact.
I mean, I'm really shocked to hear the 3 years. So is that specific to any particular service?
It's specific to trans issues as far as I'm aware, but it does vary around the country. So there's 7 different clinics, and the waiting lists to each clinic have various different waiting times. And 3 years, I think it's the Leeds clinic, was the worst one, which was actually the one that I was at. Like I said, when I first joined to sort of help out with this, I was really passionate, because I thought, how can I wait 3 years to see somebody or longer? And at the time, you didn't really get any communication in between that time, which has since changed, and that's made a massive difference. And I'm seeing that actually throughout the support group that I run in York. People are sort of no longer really sort of desperate. Whilst they're keen to get the treatment, very keen to meet and see people as quickly as possible, at least now they feel that there's a bit of a bridging to that gap.
So I'm really impressed. I'm intrigued to know, where does that passion come from to be involved, given that you had a bit of a horrible experience of having to wait for such a long time?
It was when I got together with other people that were experiencing similar problems and thinking, do you know what, I think I would be quite a good advocate for people. So I wanted to get involved, because there were people that were a lot less fortunate than I, who really couldn't get involved, and they weren't able to advocate for themselves. So I started just sort of by helping individuals in accessing services, for example, because at the time their mental health was maybe so poor due to lack of support, essentially, from the clinics. So that's where the passion came from, knowing that I could make just a little tiny difference to somebody's life and mental health.
On that note, do you want to tell us a little bit about the support group?
Yes, so I run Generate, which is a peer-to-peer support group based in York. We have now, I think it's 52 members online, surprisingly.
That's amazing.
It is, considering York's such a small place. So we don't all meet at the same time. Not everybody can make all of the meetings, but, there's usually 10 or so of us at any one time, which is great. Part of the work we do at Generate as well, which we've just started expanding on, is increasing people's social outlook. So for example, we had a trip to the pub the other night, which might sound minor to some people, but for some trans people, actually getting out the house is really difficult. So a nice organised event in a safe venue, where we've been and checked out and hired a room out specifically for the group. It's a really, really nice experience, and it helps build people's confidence. And again, it's good for mental health. It's good for making friends. It's just a good all-round thing to do.
That sounds absolutely lovely. Something you mentioned about trans people. Do trans people struggle with social isolation, and does that lead to depression? Have you seen trends within the people that you've kind of communicated with?
I think social isolation can be a really big part of a trans person's life, unfortunately. It depends really as well on how much support they've got around them, because going through transition isn't easy, and many trans people actually lose friends, family, and end up pretty much with nobody. And that's a plug that sort of our group can fill, providing the support. Because if you have no support and you are isolated, what's going to happen? Your mental health is going to go downhill. You're not going to be very confident, and you start to sort of distance yourself from society, which isn't good at all.
That's true. So how do you reach out to people and how do you get more people to be part of the support group that you run?
At the moment, it's word of mouth. So we sort of basically only invite people to the group that we know to keep it a safe space. Again, because people are very concerned, given that trans people, do come under attack for just being trans. So we try and keep it a safe space. So it's referrals really that we get in, but we do sort of have a website, and we are starting to leave leaflets and stuff around various places like the hospital.
That's actually quite interesting about the hospital, because that's probably the place where you might just, and it comes across a bit more legit and just a bit more trust.
Yeah, so we've just, in reality, we've just received a bit of sponsorship from Aviva.
Oh, right.
So they are going to design our leaflets. They're going to, because at the moment they're just sort of printed out on, little bits of home printers and what have you, which is good. It serves a purpose. But we just received a bit of sponsorship from Aviva, who are going to design us some professional leaflets so we can leave them at doctors' surgeries, the hospital and what have you. And, I think you're right. The hospital is actually a very important place to connect with. I know when I was in as a patient about 6 months ago, it became clear somebody in a cubicle a couple of doors down from me, not trying to overhear things, but they were obviously very distressed, and I think they'd gone in for a relatively minor injury. It was in A&E. They'd hurt their hand or their finger, but the sort of it became quite apparent, really, that the issue wasn't to do with the injury to their hand. It was more about them feeling unlistened to. They were struggling with their mental health. They were transgender. They were on a waiting list for 2 years, really upset that nobody seemed to be able to identify or understand what that was like. And that was quite sort of upsetting for another trans person to hear, thinking, oh, you're not getting the help that you need. I wish we had a leaflet here.
Yeah, I mean, there's something about that. From what you're saying, it sounds like there's something about lack of care, which is probably what the person was feeling.
And I think, the health professionals, it's not that they don't care. It's just that there's a bit of a gap in the system, I think, where, you make your referral, and then you have to wait.
And there's no support in that process of that waiting period?
No. So, we really do rely on these support groups to get, a little bit of help and bridge the gap for people. But if people don't know you're there, they think there's no support. So it is really important for us to get groups like Generate sort of out there and in the public domain, so word can be spread and more people can be helped.
Brilliant. I mean, it's amazing that you're doing that work and you're just helping people out. That's really commendable. So in terms of the NHS, as a trans member, do you think there are any key considerations that the NHS needs to look into when it comes to supporting trans and non-binary people and how to get them more involved in shaping healthcare?
I think as a community, we're quite vocal as it is, which is good, but we could always do with new sort of positive thinking members who are willing to take things forward. The work that I've been involved with has progressed, and we've done quite a lot of good things. So I think if there was anything I'd like to say, it would be, let's hear more about the work that has already been done. So, some of the clinicians have done some fantastic work. They've really taken on board what people want and need, but we need to hear about that a bit more. And I think that in itself will draw people in. When they realise it is making a positive impact and changes are happening, I think it sort of helps more people join. Otherwise they think, oh, it's not really doing anything, if that makes sense.
Yeah, thank you. So you've mentioned that. Is there anything you would like to kind of say in terms of final closing comments for anybody who's listening, who's probably
like you mentioned, in the transition phase and just kind of looking for what are their options?
Yeah, I think for me, the experience has been really rewarding. Not only has it been good for myself personally to be involved and feel like you're making a difference, so that to me, is really nice, but also helping others that maybe aren't quite as able to advocate for themselves. You don't have to be involved at just a national level. I do mostly national work, but there's loads of other ways to get involved, sort of locally. Your local GPs, you might become part of a patient participation group, give feedback to services locally. But yeah, I would encourage anyone to get involved and, just give it a go, start making a difference. If people feel that they need a bit of support or they'd like support, perhaps even just to make new friends, why not have a look online? There are places like TransWiki that's really good for trans people, set up by Jayas, the charity, and you'll find, or should find, a list of local support groups within your area.
Brilliant. Thank you so much, Will, for coming to the NHS England office and talking to us. This has been an extremely insightful session. So thank you so much for your time.
Thank you very much.
Thank you for listening to this podcast. If you would like to get involved in NHS England's work and share your opinion in shaping healthcare, subscribe to the In Touch newsletter. Visit the NHS England website and search for In Touch to subscribe.